Arizona Reproductive Medicine Specialist, led by Dr. Drew Moffitt, has partnered with the Butterfly Collaborative Cancer Screening Fund to expand access to life-saving cervical cancer screenings in high-risk regions such as Malawi, and he's here to tell us more. Welcome.
It's good to be here. Good to be here.
Well, the situation is very dire in terms of cervical cancer. How is it different from the rates that we're seeing here in the U.S.?
Yeah, so in the United States, only about 2 per 100,000 women will die from cervical cancer. Where I go in Malawi, Africa, about 51 per 100,000 die each year from cervical cancer. That's like 100 times more.
And it's very treatable when caught early.
Yeah, it's very simple. What we do when we go there is we look at the cervix and see if they have signs of abnormal cells. And if they do, we just take this little instrument here and apply it to the cervix for 30 seconds. Most people don't feel a thing, and we cure them. It's really quite amazing and simple.
So you annihilate that cluster of suspicious or cancerous, precancerous cells in 30 seconds.
30 seconds.
And that saves a life.
And that's it.
Wow. And you're talking about 1 in 5?
Yeah, when we screen people, about 1 in 5 in Malawi will have precancerous cells that we need to treat.
What are some of the challenges that you face in Malawi in terms of treating women?
Well, the biggest problem is we'll go there and we'll spend a week and we'll find 20 people because we'll be able to screen 100. But then we've only treated 20 people out of millions. And so what we did this last year is we signed a memorandum of understanding with the Ministry of Health in Malawi and the medical school to start a large-scale screening program where we test for the DNA molecule of the virus that causes cervical cancer. And it's really simple because the woman can just self-sample themselves. We don't have to do an exam, so large numbers of them can do it, and then we just run the test on the machine, and we find if they have the virus, and then we just see those people, and that will allow us to basically treat 100 people a week rather than just 20.
That's incredibly efficient, but it does cost money because you have to get the swabs out into rural areas, and then you, of course, have to test the swabs.
Yeah, so we drive out to these amazingly rural places where buildings are falling down, and we set up a clinic and screen these people. And then but what we'll do in the future is we'll give the samples, the person will sample themselves, and then we'll bring it back to the lab, find out if they have the disease, and then do the exam on them. Yeah.
Well, let's talk dollars and cents. What does it cost? And I know you're trying to raise money.
Right.
What can be done for a $20 donation, a $100 donation? How many lives can that save?
Sure. So we need the DNA machine, and that's about $20,000 to $30,000, and then each test kit per patient is about $5 to $7. So when we ran all the math, we realized that we can screen one person for about $20, and since 1 in 5 will have the disease, $100 will save a life. So what we ask people to do is if you can help us screen one person, that's $20. If you can help us save a life, that'd be $100. And you just go to our website, arizonafertility.com, and right on the web page is the Women's Cancer Screening Fund, or you can just search for cancer and you'll find the web page to tell you how to donate.
Thank you so much. We've got all that information here on the screen, and you can also go to our website, cw7az.com. Dr. Moffitt, thank you so much.
Thank you.
The preceding portion of the Arizona Daily Mix was sponsored by Arizona Reproductive Medicine Specialists.